County governments have a role to play in ensuring victims of snake bites are attended to. Access to Medicine's platform director, Dorothy Okemo, says, speaking during the International Snake Bites Awareness Day marked at Cherobani Primary School in Shinyalu, Kakamega County this week, Okemo said devolved units should stock antivenom drugs in Level 4 hospital, especially in areas where snakes are a common phenomenon. We urge the county governments to allocate money for stocking on antivenom drugs in hospitals so as to manage snake bites. Most of the counties are no longer putting in the budget to buy antivenoms. School-going children can be great ambassadors of creating awareness on how to avoid snake bites in communities.
Hakika tujadhari kumwona nyoka. Nyoka hula panya. I am a snake. I live softly. I can bite. I slither across the forest path as I move swiftly into the bushes. Tutumie mwangaza. Tutumie mwangaza. Tunapokuwa giza.
Tumia mwanga kama huyu anavyotumia. Hakusema usiku ukifika usiwe na mwanga, utakanyaga nyoka kisha ikume. Hii sauti ya taifa Iloro ilipotia na asili.
Tika na washukuru wenzangu. Tuondokee wengine lakini
have when talking to school children is so wide because they will spread messages to remote parts of the community, reaching to many. This will in turn create a behavioral change from cultural beliefs to making sure that victims of snake bites are taken to hospital. Catherine Shiechi, Shinyalu Sub-County Health Officer, however, said stocking of antivenom drugs in Level 4 hospital is a challenge because of the cost implications. She advised residents to immediately seek medical attention upon being bitten by a snake. Shinyalu borders Kakamega Forest, putting residents at a higher risk of snake attacks. We have directed health facilities surrounding the forest to order antivenoms from the Kenya Medical Supplies Authority, KEMSA, during their orders so that anyone bitten by a snake is promptly attended to. Raydon Imbwaka, a community health promoter, called on residents to take precautions by cutting grass surrounding residential areas to prevent snake attacks. On her part, Cherobani Primary School head teacher Florence Ludeki heaped praise on the organizers, adding that the awareness opened their eyes in as far as preventing snake bites is concerned. Marked every September 19th. According to the Institute of Primary Research, Kenya, about 20,000 people are bitten by snakes annually in Kenya. Among these cases, an estimated 4,000 result in facilities, while 7,000 individuals experience paralysis or suffer from various health complications as a consequence of snake bites.
So what we are saying in terms of our advocacy is to urge the county departments to put in some amount in their budgets, whether it's in the overall budget or whether it's within the FIF, Facility Improvement Fund budget, so that all Level 4 facilities across the entire county and in all sub-counties have at least some stocks of antivenom that then can go a long way in terms of saving lives. And I would urge the government at county level, especially in the snakebite endemic counties, to put in more effort so that snake bites are not as neglected as they currently are. One of the strategies we have employed for the snake bite is really through the school health program, because children actually understand faster, number one. They reason, so if you tell them something that makes sense, they actually take it up. But most importantly, the coverage that you would have when you talk to school children is so much wider, because they will spread the message to their friends, to their relatives, grandparents, parents, other students. So we feel the way to make sure that this message is reaching thousands of people, and that behavior change happens in terms of the cultural beliefs and practices around how snake bites happen and how they should be treated. The proper channel and the best channel is really through school children, and that is why we are taking this approach.
Rabies and snake venom is rarely stored in our facilities. One, it's because of the cost implication. So what we have done is we have urged all the health facilities, especially those that are surrounding the forest and where we know so many cases are, that during their orders, they should be able to order the antivenom from KEMSA. To urge them, once somebody has been bitten by a snake, the best thing is to take the nearest facility, take the precautions that are required. Then once in the facility, they will be observed. If they start showing signs of poison, then they will be given the snake venom.
Kwa hivyo CHPs wamepewa mafunzo ya kufunza jamii ni namna gani wanaweza zuia nyoka kuingia pale nyumbani ili wasije wakaumwa. Kwa mfano waambie jamii waweze kufyeka nyasi iliyo pale nyumbani, waweze kuchukua kuni wakaziweka mahali ambapo panafaa pale nje, ili nyoka wasije wakakaa pale kwa nyasi wala pia wale kuni pale kwa wingi.
Actually, we are near the forest and we are the ones who come in frequent contact with snakes which are poisonous. And it's good you chose on us. You gave us good information and good education. The learners are very happy. They have done the same. They have taken the same information to the parents and others who don't come to school, so that whenever they go to the forest, they at least know what to do when they come in contact with snakes.